How you doing? So this is Shane McKay, Body Mechanics Physical Therapy here in East Point Office Park, Clontarf. And today I just want to explain a little bit about non-specific lower back pain. So this is very, very common, and I see a lot of it in this clinic of mine here and have done over the past 20 years. So what is it? Well, essentially 95% of back pain is considered non-specific low back pain. And that basically means that it's occurred from an injury like a sprain, or it's insidious, it's just come on. And that would even include disc bulging, which is often said to be DJD, which is degenerative disc disease or wear and tear. So it's very, very common. About 5% is something more serious. It's something like spondylolisthesis, where you get kind of like crumbling of the spine where the vertebrae are kind of very unstable. That usually happens in older patients, and then you also have cancer or tumor in that. But 95% is non-specific lower back pain. It's a very global term. So what are the sort of things I'm looking out for when somebody comes through my door to try and understand what is driving their back pain? So after I get a history of them, what I really want to do is I want to have a look at the move. This is called the objective assessment, and that can tell me quite a lot. So the first thing I'm going to do is I'm going to get them to see if they can do a toe touch. And really what I'm looking for is this. So just to explain what's going on here. And this guy, Mr. and Mrs. Flexible, touches the floor. Basically what happens here is they're able to lengthen their lumbar spine, and the rib cage is able to depress, and the pelvis is going to rotate backwards, and that takes the tension off the hamstrings, and they more or less have kind of like straight legs, and it's easy for them to get down here and touch their toes. Coming to the more common person, this person over here, and they have low back pain. Okay. This is Mr. Happy here, he's good. This is Mr. and Mrs. Unhappy. So what's happening in this case is that when they got to touch their toes, their lumbars are very flat, and that's to do with them not being able to get this rib cage to come down and depress. That also means then this pelvis is not going to rotate backwards into a more neutral position, and that's going to create tension on the hamstrings. So they have to bend their knees to help them get down to touch the floor. That's very, very common. And what I'd often hear somebody say to me is, very hard for me to get my socks on in the morning and put my shoes on. And that creates a cycle where muscles aren't working then around the trunk. And somebody with really many episodes, their movement then is impeded because they're all the time trying to protect or trying to negotiate their movements. Whether it be putting shopping in the boot or going out to pick up some rubbish out of a bin, they were negotiating their movements, and really it stops them moving. So then also what we get them to do is leaning back, which is extension like this. And what I really want to see here, which is Mr. Happy, Mrs. Happy again, sorry that pen isn't working too good, that's okay, is that they are leaning back, and what's happening as the rib cage is elevating. All these muscles at the front, the abs, the obliques, they're lengthening. Muscles around the shoulder girdle are also lengthening, and they're also putting their load towards their toes. So it's like a cantilever. And this is what you want to see. If they put weight more through the heels, they set off posterior chain of the back line, and very often they'll hinge and get pinchy in the back because the back muscles and the facets now are locking up. But for this guy, he won't be doing that. He'll have nice movement with this girl. This is where the movement is impeded. So what we're seeing here is the inability for the shoulder girdle muscles to relax and lengthen, and also the rib cage is unable to elevate and have height. And that's because these muscles at the front are not lengthening, which is the abs and the obliques. And then also they're bending their knees because they don't want to load their hamstrings. They want the quads more to load, and they're not going to transfer the weight. The weight is more to their midfoot to heel, and not to the toes. So I look for all these movements, and this gives me a good indication of what's going on, where I can restore movement to get them moving better. And essentially, this is a lot of stuff you would see with somebody over a long period of time who these muscles now have become defunct. The back is very switched on, the back is doing a lot of work, whereas the leg muscles, they need to do a lot more, the trunk muscles need to do a lot more. Okay, so if this is you, call me. My name is Shane McKay of Body Mechanics, 087 943 6093, or email me at info@bodymechanics.ie. That's info@bodymechanics.ie. And I'm sure I can really help you get over your back pain. Chat to you soon. Take care. Bye bye.